From new COVID-19 variants to monkeypox, everything you need to know about vaccines, travel, COVID reinfections, and keeping yourself safe. All coming up next.
Live from Los Angeles, this is the Special Report with Areva Martin.
Even though we haven't heard our public health officials talk a lot about COVID reinfections, vaccines, and even monkeypox, if you go down your scroll on your news feed, you will find that COVID is on the rise again. There's a new variant, and lots of people are getting COVID for the first time, and many are getting reinfected. There's talk of new vaccines that are coming out just to target the Omicron variant. There's also news about monkeypox, who it's infecting, and what you need to know about it to keep yourself safe. And of course, it's summer, so lots of people are traveling. They're on buses, they're on planes, they're in airports. And we know that the mask mandate was lifted a couple of months ago, but a lot of folks have questions about whether they should be wearing a mask. Should they be masking up again? And even Los Angeles County public health officials said recently that starting July 29th, the County of Los Angeles, with its 11 million people, will be required to mask up again in public places. Now, other county health officials are saying LA is overreacting, that there is no reason to go back to mandatory mask mandates or mandatory anything as it relates to this public health crisis. But the LA County public health official said the reason she and the Board of Supervisors in LA County were requiring masks is because of the disproportionate impact of COVID on communities of color in Los Angeles, on Black and brown people, which got me thinking, should we be having more requirements, more mandates nationwide, not just in LA, to save the lives of Black and brown people? And are our public health officials failing us by not talking more about COVID reinfections and the rise of the Omicron variant? Are they letting Black and brown people down? And what's going on? Have we seen Dr. Fauci? I know he's retiring, or he said he's retiring in 2024, but we rely on our federal and local public health officials to get us through this public health crisis. And for the most part, they are pretty MIA. What does that mean? And what are we as individuals trying to keep ourselves safe to do with, can't say all of this information, I'll say all of this lack of information. Here to help us sort all of this out, our first guest, she is Jill Rosenthal. She is the Director of American Health Policy at the Center for American Progress. Good morning and welcome, Jill.
Good morning, Areva. Thank you for having me.
We're all puzzled, Jill. For months at a time, we couldn't turn on our television without hearing from the nation's leading public health officials about COVID and how to keep ourselves safe, whether to mask, not mask, get vaccinated or not. And now, even though COVID is on the rise again, where are the public health officials?
Well, those are all really great questions. I think a lot of it comes down to the fact that people are sick and tired, as we know, of COVID. But that doesn't mean it's gone away. And as we can see right now, it's coming back a little more fiercely than it's been recently. So, as you said, we have a new variant, the BA.5 variant. We're seeing a surge in cases around the country. 40 states are seeing cases. Hospitalizations are going back up again. The death rate's gone up a little bit. And we're seeing more community transmission. So this new variant is the most contagious or transmissible that we've had so far. So certainly there's a need to be paying attention. I think the issue is trying to get people's attention at this point. People are tired of it. They don't want to hear about it anymore. But regardless of that, there are things that we can be doing to keep ourselves safer. And I think that we've seen a real shift, we've talked about before, in moving to personal responsibility and people, needing to do the things messaging around doing the simple things that people can do to keep themselves safe. And those are getting vaccinated, wearing masks in indoor settings and crowded settings. And we're going to continue to see, I think, more pleas for folks to do that. This vaccine or this variant.
Let me stop you for a minute, Jill, and ask, what does it say about our public health infrastructure if during a time of public health crisis, public health officials are mum? They're quiet, they're missing. And this notion of personal responsibility, I find that offensive that, they're telling us as individuals, not trained medical professionals, not public health experts, to take it upon ourselves to keep ourselves safe when this is the job of these public health officials.
Yeah, absolutely. A great question. And I think, this goes right into the monkeypox issue too. We're dealing with, as we've seen through the pandemic, a system that has chronically been underinvested in. There's issues around data, there's issue around workforce. And I think you see a workforce that has been harassed and bullied. People are leaving the fields. It's just become a polarized issue that really shouldn't be. It's a health issue. And that's what our public health professionals are there to do. But unfortunately, we've seen a reduction in authority of public health departments around the country. So this is, a really difficult situation to try to message appropriately and take the steps that are needed to protect the public when in many places the public doesn't want to see that happen.
Yeah, I was joking with someone that he looked like Dr. Fauci was in the witness protection program for months because we never saw him. And I saw him recently on a show, and he went to great lengths to say that his recommendation about wearing a mask was not the official, White House recommendation. And this was not a mandate being imposed by the White House. And he kept saying that over and over again. And I felt, oh my God, somebody has obviously told him to not go out and publicly make it appear or to give any indication that this is the official statement from the White House. So it says that this is being, politicized in a way that the public health officials are having to navigate this political landscape and not just be focused on our public health.
Absolutely. I mean, you can even just look at vaccination rates, and there's, a difference between states that voted for one party over the other. We can see red states have lower vaccination rates. And so, I think at this point, we're unfortunately at a place where personal responsibility is more and more important. And I think that the administration is still talking about, making sure that supplies are available, that they're free, they're available. And I'm talking about vaccines and tests and masks and messaging that this is not gone. People might wish it were, but it's not.
But I think in this vacuum, Jill, you see whenever there's a vacuum, right, it's going to get filled by someone or something. So there's, again, a lot of disinformation that's out there, even around the testing. I had someone say to me the other day that she thought you couldn't even use the home test until you had symptoms for 3 days. And I says, well, I don't know if that's right, because I myself have had COVID, and I was told you have to contact your health provider within the first or second day to get the antiviral medication. So I says, well, if you are only eligible for antiviral in the first or second day after symptoms, if you wait 3 days to take the test, you're going to be past the time that you're eligible for the antiviral medication. So, and both of us thought we had heard something different, and she waited for 3 days to take a test. So we're making this up, I guess is my point. So, we're hearing bits and pieces, and as this personal responsibility means me, non-doctor, my friend, non-doctor, both have our own theories about how to test and when the testing period is. I don't know who's right. We never really got to the right answer to the question.
Well, and that also points out that it's evolving, so it changes a lot. And so we do rely on public health professionals to give us that information we need. I think, we also forget that public health protects us in many ways, and in ways that many of us want. It's our food safety, it's access to clean air and clean water, and other things we rely on public health for. And so if we let the system kind of, if we continue to underinvest in that system, it's not there when we need it. And again, you can see that with COVID, and now you can see it, kind of happening again in some ways with monkeypox.
Yeah, before we go on to monkeypox, I want to ask you that monkeypox, what do you make of some attacks that were made against the LA County public health official who said by July 29th, the county's going to require us to mask up. And she said the reason was because of the disproportionate impact of COVID in LA County on Black and brown people. And that was a national issue, not just the LA County issue. And some other public health officials attacked her. And I felt like, oh my God, here's a woman trying to protect minority communities that were hard hit by COVID, and other public health officials are basically saying, forget those minority communities. They're not worth saving is kind of how they didn't say it that blatantly, but that's implicit in what they were saying.
Yeah, I think that when those mandates went away, the idea was follow the data. And when you see indicators that tell you it's time to put them back in place, then you put them back in place. That's really hard to do, I think. And that's what she's trying to do. And she is looking at the data in her community and saying, look, this is where we are, and this is what we need to do to protect our community. And absolutely, there's no question that Black and brown people have suffered more through the pandemic. And, in some cases, may not have the resources necessary to either protect themselves or get the treatments they need, or, maybe more likely to be exposed through having to be in work in person or whatever else it may be, that when surges happen, the disparities increase. And so I think she's following that information.
Yeah. And, sadly, like I said, she was attacked for it, and we're not seeing other public health officials, even in blue states that have been very pro-vaccine and have been pretty aggressive in getting information to their citizens. We haven't seen, other states take the same position that she has. And that's troubling, obviously. So it does mean individuals have to fend for themselves, have to figure out this information on their own. And then in comes the stories about monkeypox that also are alarming. What is it that we should know about monkeypox?
Yeah. Well, again, I think some of it has to do with the fact that we haven't invested in the systems we need to test and do disease surveillance. And I think one last point about what you were just saying was that in some cases, public health officials are stymied by the fact that they're being fired. They're being, their jobs are at risk. They're being harassed. So I think that is an important consideration. But turning to monkeypox, I think, it's certainly not the kind of risk that COVID presents to us. Health officials are saying at this point it is low risk, but it's certainly impacting certain communities. And, again, we need to be able to do the disease surveillance and testing to be able to identify people who are most at risk. And the campaigns really now are about identifying those populations and getting vaccines to those people who are at highest risk.
And monkeypox, to be clear, is a viral condition that presents like chicken sores or blisters. Is that essentially what it is?
Exactly. So it's spread from person to person through contact with an infectious rash. It can also be spread through scabs. And so it's really important for people to know what it is. And I think that's another part of it is the communication right now so that people can identify it and get the health care if they need it, that people that are around them know how to protect themselves and not have, interaction with scabs or with bodily fluids or things that allow spread to happen.
What are the common symptoms? Do you know if it presents first as the sores, or is there fever or chills, body aches, pains? What else is associated with it?
All that. I think it's those symptoms that kind of look like flu that, are similar to COVID, the ones you just mentioned, but also the scabs are kind of a signature mark of the of the disease.
Is there a test, and is that test only available in a hospital or a clinic, or are there home tests like the COVID home test for monkeypox?
There are not home tests yet. So they're only available through certain laboratories, but going to a healthcare provider can help you get connected to the tests that you need to have. And some of that has to do with making sure that the information is getting into systems so that we can keep track of where it's spreading and, where the resources are needed. There's a shortage of vaccine at the moment. So again, making sure we know where to target it so that it's getting to those communities that are seeing higher rates.
And unlike COVID, monkeypox is only transmissible by skin to skin contact, correct? So it's not like you can be in the presence of someone, and they cough on you or breathe on you. Is monkeypox transmissible that way? It
can be spread through respiratory secretions, but it needs to be a prolonged contact, and that's not commonly how it is spreading. So at this point, it's mostly spreading through intimate physical contact and is mostly among networks of men who have sex with men.
Let me go back to COVID for a minute. We're seeing not just a rise in this BA.5 variant, but also lots of folks who have had COVID, who thought they had antibodies like me, are getting reinfected. What is it about this variant of Omicron that's causing such high rates of reinfection?
It is this new variant is more resistant to vaccines. So we are certainly seeing more people get reinfected. And I think that's why there's such a strong call for people who are eligible for booster shots to get them. The booster shot rates are pretty low right now, but for those who are over 50, they should be getting a booster to be protected, since we are seeing it's more likely for reinfection to happen. Luckily, people who get reinfected are less likely to be as severely ill as the first time. But, long COVID is still out there. And so we want to make sure that people, again, do what they can do to protect themselves. And vaccine is still the most effective way to do it.
And has the guidelines changed at all? The CDC guidelines, are the guidelines the same that 5 days of isolation, and that 5 days starts from day one of your symptoms?
Yeah, no changes have been made in the guidelines at this point. Right. I think that there is the new vaccine option that was just approved for folks that were not comfortable with the technology used in the vaccines that we've all had up to this point. So there are new options for people who haven't been vaccinated, and there'll be new vaccines in the fall/winter that I think, will give us another boost of protection, because we do see that the protection wanes over time.
And is there any concern in the public health community about just the number of vaccines we're being asked to take? Like, most of us have had, 2, if we did Pfizer or Moderna, and now there are 2 boosters. So that's 4, in some cases in a year. And now you're saying there's going to be some new ones in the fall. So, maybe 5 vaccines in less than 18 months. Is there any concern about that?
At this point, it really is, the harm of COVID is much, much greater than any concern about vaccines. And it's not going away. COVID's not going away. So I think, the hope is to get to the point where we need perhaps like an annual booster, the kind of like the way flu is. So, but because the variants have been evolving quicker than the vaccines, we're kind of playing catch up right now.
What happened to this concept that after 70-80% of us had COVID, we were going to have this kind of community immunity? What happened to that?
We didn't get to the numbers. There were too many people that were not interested in getting the vaccine. It took a while to roll out vaccines for younger populations. Young children are just eligible. And, I think when the vaccine first came out, we thought everyone would jump at it. And, we would be able to get to that community herd immunity, but we weren't able to get there. And so that leads us to the situation where we're in now, where the virus continues to mutate because we haven't been able to control it.
And some articles that I've read, some doctors say, don't change your activities. Go about your life, continue doing what you're doing, wear a mask if you choose to in a crowded place. Do you agree with that? Because I know lots of people are very fearful and they are changing their activities. They're back to isolating in their homes. They're not going out. They're not going to restaurants. They're not going to shopping malls. What's your take on what individuals should be doing in terms of their daily activities?
Well, I mean, we do know that the vaccine, for folks who are vaccinated, it really does protect against serious disease. And so that makes a huge difference. So for folks who are vaccinated, we also know that masks really do reduce spread. So for folks who are vaccinated, and when you can wear a mask in a crowded indoor setting, it provides a good amount of protection. So if we can continue to do that, we'll be able to continue to do the kinds of activities that we want to do without seeing things close again. So I think that's where we are right now.
So essentially you're saying to individuals, if you're vaccinated and you're masked, go about your daily lives. Just restaurants, shopping malls, movie theaters, travel on planes and trains and buses.
Yeah, pretty much. I mean, I would say personally, I'm not so comfortable eating indoors because you don't have a mask on, but generally I would say yes.
All right. Well, obviously, lots to be thinking about as people are trying to decide, summer travel, family events, lots of family reunions, weddings. This is big wedding season. So with weddings come big receptions. So folks have to make some decisions. And unfortunately, you don't have your public health officials out front talking about what those decisions should be. So we've got to do our own investigatory work and make decisions that are, in the best interest of ourselves and our families and our communities. And ultimately, as you said, vaccinate, vaccinate, vaccinate. That's the one message that we want to make sure everyone is getting from all of this. Thank you so much, Jill, for joining us, and thank you for sharing this information.
Thank you.
My next guest is Eric Bottcher. He is a city council member in New York City, representing the 3rd District. Good morning, Council Member Bottcher.
Good morning. How are you?
I'm well. Thank you so much for joining me this morning. I know that you represent Hell's Kitchen and other parts of New York that have seen a pretty significant increase in individuals who are reporting that they have contracted monkeypox. And I want to ask you first, how are you handling it? How is your district doing?
It's been a tough few weeks. I'm not going to sugarcoat it. As you said, I represent the west side of Manhattan, which is the neighborhoods of the Village, Chelsea, and Hell's Kitchen in New York City. And we are the ground zero for the monkeypox outbreak. And one of the hardest things about this is that we all know people who are getting monkeypox left and right. And people are being told to get vaccinated. There is a vaccine and you should get it. But guess what? We don't have the vaccine in store. So that is creating a lot of fear, frustration, and anger right now.
Let me ask you, Council Member, is the vaccine you're referencing, is that different than the vaccine that's being made available for COVID-19?
It's a different vaccine. It's a vaccine that is actually also used to treat smallpox. And it was recently ordered by the United States. We ordered millions of doses of this vaccine in anticipation of this kind of scenario, but they're not ready. Why aren't they ready? Because the United States has millions of doses sitting in a factory in Denmark. The FDA authorization on that factory expired last year. So they're sitting there, we're waiting for FDA authorization to get this vaccine to the United States. We have some here, and they're distributing it slowly, but it's not nearly what we need.
So I know from reading in the New York Times where you quoted that you actually know individuals yourself who have contracted monkeypox. What are they telling you about their symptoms?
So monkeypox has flu-like symptoms, but also like blisters, like a pox, like a chicken pox type blister. They're painful. They start as blisters, and they burst and they pus and they scab over. And I have some folks on my social media feed who are uploading photos of themselves with monkeypox on their face. One of the scary things about monkeypox is that there is the potential for permanent scarring. You have people with these blisters on their private parts, very, very painful and uncomfortable. Luckily, no one has died from monkeypox in the United States. It has happened, but it hasn't happened here. But it's still a very serious disease.
And we're also hearing, Council Member, that this pox is impacting mostly men and men who have sex with other men, although what I've read and what the experts say is the skin-to-skin contact. Are you concerned at all that somehow this gets associated with, gay men and somehow gets stigmatized?
It is stigmatized, and we've seen this throughout history with the LGBTQ community, how diseases can be associated with our community and can be used to stigmatize our community. And we're already seeing this in right-wing social media channels. And I've seen some memes where our community is really smeared because of monkeypox. And it's just, it's painful on top of everything else that we're dealing with. And it's really unfortunate.
Yeah, and as far as the public health officials are concerned, this is not a condition that just afflicts gay men. I want to be clear about that.
That's
Do you
right.
think that message is being disseminated widely and loudly enough?
Well, the truth is that anyone can get monkeypox, but the truth is now that it's almost all gay men, bisexual men, and other men who have sex with men who are getting it now. So I think while we have to stress that anyone can get monkeypox, we also have to be sending a strong message to folks in our community that we are the most at risk and that we need to get vaccinated. The problem is we don't have the vaccine, and I just think it's unconscionable that in the United States of America, supposedly the most advanced country in the world, coming right off another global pandemic, we are facing another outbreak, another pandemic, but we don't have the vaccine for people to take, a vaccine that exists. I think it's embarrassing, quite frankly. As an American, I'm embarrassed by it and very angered by it.
Do you think your Mayor Adams, the public health officials in New York, the White House, the Biden administration, are they listening to you and others in the LGBT community who are saying, look, we need this vaccine and we need it now?
I do believe they're listening now. It's primarily an issue of getting vaccines for New York City from the federal government. I spoke to folks in the White House, and they assured me that they are dedicating all their resources to making this happen right now. Unfortunately, it's not good enough because we need those vaccines in New York today, not this weekend, not tomorrow, today. And that's not happening.
Is there anything that's being done from a public health perspective to contain the spread? We know with COVID, in the early days of COVID, families and people were instructed to stay home, to socially isolate. What's happening with respect to how public health officials are treating monkeypox to try to contain it?
The public health officials in New York City are urging people who, if you have symptoms, do not engage in contact with others, isolate if you have symptoms, and if you feel that you've come in contact with someone who has monkeypox, isolate. That public health guidance, we are pushing that out far and wide. Also, if you are in a high risk category, get vaccinated. We don't have nearly enough vaccines, but they have released a few thousand vaccines, and we have about 24,000 more vaccines coming to New York, hopefully within in the next week. So if you're in a high risk category, if you are a person, an MSM, gay man, bi man, who's had more than one sexual partner in the last 14 days, or who's had anonymous sex in the last 14 days, or who's come in contact with other people who you feel have, get vaccinated.
Are you seeing individuals in your district, Councilmember Bottcher, who are canceling events or changing their activities, changing their daily behavior because of the spread?
Yes, and I think that is a responsible thing to do, particularly people who are engaging in things like sex parties and other things that happen. It would be wise to wait until we get a handle on this and until the vaccine is widely available.
And we know antiviral medications are being given to individuals with COVID who come down with COVID-19. Are those same antiviral medications being made available, or similar ones, to individuals with monkeypox?
There is another antiviral medication called TPOXX. Unfortunately, it's also not widely available, and it is apparently highly effective. So that's another thing we're dealing with. We're dealing with a problem with getting the antiviral medication out to people right away. We're also dealing with problems with testing. Testing is becoming more available now that you have like Quest Diagnostics and others starting to do the tests. But we're also getting test results. We're seeing problems with people getting their test results. When they take a test, they've got the symptoms, they're home, but they're waiting like a week to find out what their results are before they can get the medication. In New York City, in the United States of America, this is not how our public health system or private health system should be working.
Yeah, thank you so much, Council Member, for sharing this information, and we'll do our best to get the word out as well, and hopefully that those doses of vaccine as well as those medications will make their way into your district, into New York City, and we can definitely contain the spread of monkeypox. Is there anything you want the general public to know that hasn't already been said that can maybe help someone who might be dealing with this, or someone who may come into contact with another individual that has monkeypox?
Please join us in contacting the federal government. Go to the White House on their website, reach out to them, let them know that this is a priority. We need to keep up the pressure to get these doses, these millions of doses of vaccine that are collecting dust. They need to get into people's arms right now.
All right, we'll do our best to help in that effort. Again, thank you so much, Councilmember Bottcher, and best of luck to those that live in your district, and that they get the help that they so desperately need.
Thank you.
My next guest is Deshaun Usher. He is the Director of Communications and Media for GLAAD. Good morning, Deshaun, and thank you so much for joining me.
Good morning, and thank you so much for having us.
So, you heard the council member from New York. He's the council member of the district that includes Hell's Kitchen, part of the West Village, where there's been this huge uptick in the number of monkeypox cases because there are lots of members of the LGBTQ community that live in his council district. Are you concerned at all about the messaging that's going out? The council member talked about in conservative media, but what are your thoughts about the messaging around monkeypox and its relationship to the gay community?
So I think one of the things that we saw early that we wanted to ensure at GLAAD was that misinformation and disinformation was not spreaded, or that it would also be stigmatized against the LGBTQ community. So in early June, GLAAD actually provided guidance to the media covering monkeypox in the LGBTQ community, which included recommendations of including people that are within the LGBTQ community to share their stories, encouraging reporters to speak to those people directly, ensuring that we emphasize how transmission of the virus actually happens. So facts over fear, but then also ensuring that like the facts and broader public health information reached the largest populations. And so I think what we're seeing, particularly within the LGBT community, is that the information has gotten out to a lot of our community. And so there's an even more increase in demand for vaccines that we know we're still waiting on and like are being distributed.
Are you happy with the way the media has carried the message forward, given the training and given the information? I don't know if it was training, but given the, the talking points that and the recommendations that you all gave to the media in June?
Yeah, quite frankly, I think like the media aspect has gotten it right. I think it's still more that we can do to ensure that we're reaching the most vulnerable people within our community, ensuring that we're reaching Black and Brown communities that are within the LGBT community that may not necessarily hear the same message as early than other like people within our community, but then also ensuring that they are well enough informed to go to their doctor or look at their local healthcare providers to ask for the vaccine or get on the wait list to get a vaccine when it's available within their particular jurisdiction.
So one of the issues that's come up, Deshaun, is whether monkeypox should be classified as a sexually transmitted disease, a STD. And it appears that in the medical community, it's not technically an STD, but that there are reports that it's mostly being spread through contact, through your private parts. I've read some stories of men saying that they have the sores on their backside, in their anus. So are you concerned that if this does get to be talked about as an STD, that will stigmatize the condition and, cause there to be attacks on the gay community?
Yeah, no, actually, I'm not concerned that it would be that it would further stigmatize because it's not true. So it's also the fact that monkeypox is not an STD. It cannot be an STD because it's not only spread through sexual transmission. So I think the biggest key points that folks have said or mentioned is skin to skin contact. And so, yes, when we think about what's the fastest way to spread a virus, sex, right? That's the most skin to skin contact that you'll probably be able to engage. But you can also touch things from somebody that has monkeypox and contract monkeypox. And so I think if we put out that information that it's an STD, it then becomes misinformation that people outside of the LGBT community, but other folks that would come in contact would not think that they have monkeypox because they haven't encountered sex or thought that they had a quote unquote STD. And so I think it's important to understand that, again, the primary transmission of monkeypox is skin to skin contact. The primary infection. And when we think about viruses want to survive. They don't discriminate on any community. They're literally trying to survive. And so the more that people are engaging in skin to skin contact or at the highest rate of their viral transmission, it's easier to pass along. And so I think that's the most important thing is to understand, and that it's also closely related to smallpox. And I think that's another thing. And smallpox was never an STD. And so we understand the history, at least with smallpox, that this gives us a template for the monkeypox virus.
Yeah, and I'm not suggesting that it is an STD, but I'm just saying some of the stuff I've read, it's being loosely characterized as an STD. And we know how AIDS, in the early days of AIDS and its association with the gay community, how, that impacted funding, right? It impacted the speed at which we saw our public health officials tackle finding a cure, finding appropriate medications for AIDS, because it was, something that impacted that other community. So I'm just saying, are you concerned at all that if monkeypox gets, that characterization of being that gay virus, that could impact the speed at which vaccines, get into certain communities, the speed at which medications and other efforts are made to alleviate the spread of monkeypox.
Yeah, and I think exactly like what you're saying, as far as like what you've may have read or may have seen, for anyone that is trying to group or classify it into it being an STD, that's largely why it's it cannot be grouped as simply as that. While that's the fastest way for the transmission to happen, it's also to understand that if it was to be grouped as simply as an STD, then you miss so many people in the community and the resources that are needed to actually treat, in order to vaccinate, to prevent, or at least help with the possible symptoms, in case if someone was to contract monkeypox. And so there's a larger part for us to ensure that we don't just classify it as something that it's not, but also to understand that we have to engage with particular communities to educate them, to bring them along, to also make sure that they have the medical trust for their providers and the information that they're empowered enough to know that this is a rash that wasn't here last week. And this is something else that's showing up on my body that I hadn't noticed before. And so understanding that it can impact anybody, while it's early right now, disproportionately impacting the LGBTQ community.
Yeah, is there anything that you want, I know you've said you want people to understand it's not just for the gay community, so that people aren't being missed, they're not being misled to think that they can't contract it. Any other messages you think are important for the public to know about monkeypox?
Yeah, I would just encourage people that if you are concerned about monkeypox, or you want to inform yourself or your community more about monkeypox, to definitely visit the CDC website, as it has all of the outlines of what to look for. But then also in your local jurisdiction, please be in contact with your health department to figure out what are their vaccine distribution aspects of getting the vaccine, and if there's how do you qualify, right? And so right now we know that the vaccines are going to the most vulnerable and most in need within local jurisdictions. And so there will become a time, I'm sure, where it will open up once more vaccines are manufactured and able to be distributed. But right now, I think it's important to understand that if you feel that you're at risk, or you come in contact with somebody or has been exposed to it, to definitely check with your local health authorities for that.
Great advice. Thank you so much, Deshaun, for sitting down with me this morning and for helping us know where to go for resources. Great to direct folks to the CDC website and to their local county health websites to get further information. Again, thanks for the work that you're doing on this issue.
Thank you so much.
All right. And our final guest this morning is John Moore. Dr. Moore is a vaccine expert at Cornell Medical School, and we rely on Dr. Moore. We have relied on Dr. Moore for the last almost 2 years now to help us understand what's going on with vaccines and COVID. And now we have this BA.5 variant and this monkeypox condition, which is spreading, but not nearly as transmissible as COVID. Good morning and welcome back, Dr. Moore.
Hi.
I'm distressed, Dr. Moore. I have to tell you, I got COVID in May and I thought, okay, I got antibodies. I'm good. I've been vaccinated. I've been boosted. And now I'm hearing from so many friends that they're getting reinfected.
Absolutely.
Why are we getting reinfected? And am I at risk for reinfection?
Unfortunately, everyone is. The virus is outmatching the vaccines because it's mutated to such an extent, particularly the Omicron lineage that appeared in the US in mid-December and then triggered the winter wave in December, January, huge number of infections. And since then, that lineage has further mutated to become even more resistant to the antibodies that are induced by the original vaccines and by earlier infections. So the virus has acquired the ability to blow past protection conferred by virus neutralizing antibodies. That's where we are. But these infections are mostly mild in people who have been previously infected or people who are fully vaccinated. So we are not seeing an increase in the death rate in the USA for months now. It's been pretty flat at around 300 to 400 deaths a day. Now, that's still a very high number, and we shouldn't be complacent about it. But we're not at the levels where 3,000 people a day were dying in the winter of 2021, for instance. So, and I think we've become blasé about this because it's not a huge number of 3,000 deaths a day. We're ignoring the fact that 300 to 400 people a day are still dying. But it's not increasing because the vaccines and prior infections are still protecting against the worst outcomes of COVID. So we're seeing a lot of at-home infections, and they can be quite unpleasant. My daughter had one 2 weeks ago, really bad sore throat, felt lousy for a week, obviously couldn't work. So we're not trivializing that. But again, people are not dying at the rates that they were. And most people who are unfortunately dying are people who've refused to be vaccinated, which is a theme throughout the pandemic, or people in the most vulnerable health groups, pre-existing conditions, older people, people who are generally more at risk. We're not seeing deaths among 20, 30-year-olds at anything significant rates. It happens, but it's not a huge
right
on our society.
Dr. Moore, when you take the home test, you're not able to determine what strand of the virus you have. When you go into a clinic, are they able to isolate the strand and tell you if it's BA5 or Delta or some other strand of the virus?
Well, research labs have the technical capability to do that, but it's not particularly valuable information because it just is what it is. And in the States now, almost all infections are with the BA4 and BA5 mutants. And there's another one, 2.752 or something. The numbers get horribly confusing now. But the high probability is that if you come down with an infection that's picked up by your at-home test, then you've got BA4 or 5. That's what is certain.
And are there any differences in the symptoms or recovery time between 5 and 4?
Not really. There's some hints that BA5 may be a bit more aggressive, but it's not been validated by really solid data on it. And again, we're not seeing an uptick in hospitalizations that coincide with BA4 and 5 emerging. Hospitalizations have been on the rise because there's so many infections. It's a numbers game. And remember, most people do not report at-home test results to CDC or Department of Health. I mean, it's just not being done. So the official figures for infections are around 120,000 a day, but that's probably underestimated by fourfold. It's probably 500,000 or more a day. So there's a lot of virus around.
And we know that the public is just exhausted. That, COVID fatigue is a term we hear often.
Absolutely.
What do you say to folks? And most of the papers and news that I follow says, go about your life. Don't shut down. Don't stop going to movies. Don't stop going to restaurants. Don't stop travel. Do you think that's the right approach?
Well, it's what people do. It's what people are doing. I behave normally. I am not adjusting my behavior in any really significant way. I wear a mask on the New York subway, and about half the people in a subway car are doing it, which is less than it used to be, but more than it might be. So, I socialize to the extent that I would ever socialize. I'm not paranoid about it, but I'm aware of that there are consequences. And, people need to balance their desire to have a life with their fear of becoming ill. And that's very much down to individuals. There's not much we can do about that. I mean, we're not going to lock down in a basement at the moment. It's just not going to happen politically and psychologically.
So, Dr. Moore, we were all led to believe we were going to get to this magical thing called herd immunity. And we haven't gotten there, according to Jill Rosenthal. She's a public health, professional. And is this because we still have so many people who refuse to get vaccinated, who refuse to wear masks, and who refuse to follow, the basic protocols that public health officials have been talking about for months now?
Well, that certainly doesn't help, but it's a mutation of the virus. See, most of us have immunity against the COVID virus. We do, either through vaccines or infection or both. But that immunity is not protecting us from infections. It's giving some protection compared to someone who has had no exposure, and there aren't many around now. But it's not protecting well against an infection. But it is protecting well against severe disease and death. So we have, to some extent, herd immunity against dying, but not herd immunity against getting infected.
Okay.
And that's an important distinction.
You know, it's a very big distinction between getting the virus and recovering and getting the virus and dying.
Yeah.
What like right now, summer travel, weddings, receptions, summer camps. Should parents just send their kids to summer camp?
Well, again, they have to make a decision based on their fear of infection and their desire to have a life. I mean, I said my daughter got infected a couple of weeks ago. She went to a bridal shower, kind of against her best judgment, but, you know, it was a bit of social pressure from her friends. At least 3 of them got infected at that event. She regretted going. But, you know, there you go. It's, what are you going to do? People have to make decisions based on what they feel is best for them as individuals and their family and contacts.
So your daughter, for instance, if she didn't go to that bridal shower, obviously maybe she wouldn't have gotten it. Maybe she would have gotten it at the grocery store. Who knows? But in making that and regretting that decision not to go there, is she also saying, I'm prepared to not go anywhere? And again, that's where I think people are stuck. Like, I may not go to this function, but does that mean, you know, I cancel my whole summer plan?
Well, I don't think there's a cookie cutter answer to this. Again, it's awareness. I mean, in the case of my daughter, having been infected only a couple of weeks ago, in all probability, she's not going to get reinfected for a few months. I mean, there will be a boost to her immune system that will give her some transient protection. But there are plenty of examples of multiple reinfections taking place this year. But again, some people do and some people don't. I've never been infected and I've not been living in a basement. But I'm well vaccinated and I don't do, you know, stupid things, but I don't live in a basement. Mm-hmm. But where are we with vaccination? I mean, I think a lot of us are quite annoyed at FDA and how they're handling the very confusing setting. I mean, the FDA has announced that there's going to be an adjustment of vaccine composition later this year to something based on the Omicron lineage. So we're going to have a BA.4/5 vaccine maybe in October or November. And that sounds good, but when you look at the science behind it, it's not a magic bullet. It's that vaccine with the adjusted composition. When you look at its performance as a booster compared to the standard vaccine, the one that we've already got around, the difference in performance of the Omicron vaccine is marginal. It's a bit better at inducing antibodies, but it may not translate into better protection against infection for very long. So, you know, we've got to be aware that vaccine composition change isn't the answer to the pandemic and a magic bullet that will mean we can just forget about it. It's not going to be like that. And there's also confusion about whether people should get a standard booster now or in the near future, which FDA is considering, and then an Omicron-based booster in a few months' time. Well, the problem there is you need to space out your immunizations, not because it's dangerous, but because it doesn't work as well. If you have a booster now with the standard vaccine and a new booster with a different vaccine in a month's time, that's just not advisable. It's not going to work as well. The vaccines only take well after a certain period of time, which is probably 4 to 6 months. So if you're going to have regular boosters, which some people may choose to do, you need to space them out at 4 to 6 month intervals. You know,
okay, so are you saying if you've not gotten booster number 2 yet, you recommend waiting and not getting it now? Because if you get it now, it's not going to make sense to get this new fall B4, B5 booster?
Anyone who's eligible for a booster dose, the third dose, should be having it.
Well, there's a 4th dose now.
Well,
right?
The 4th dose for those who are authorized, but the 4th dose, you shouldn't have it until you've had 3 or 4 months after your 3rd dose.
Okay, but let's say you are 4 months post the 3rd boost or 3rd shot. you're thinking about getting the fourth one now in July, but the new Omicron booster may hit in September or October. Should you get the fourth one now?
Yeah, and this is a very common question, and it's why a lot of us are annoyed with FDA and CDC for not giving the right advice, and maybe they don't understand the dynamics here or whatever reason. But you need to space your boosters out, and you also need to factor in whether you feel or know that you're at risk if you don't get a booster. So if you had a booster in January and you're in a high risk group, and at risk of severe infection and disease, get a booster now and don't wait another 3 or 4 months. So you've got to look at your own personal situation. When did I last have a vaccine dose? And what is my need? And again, there's a world of difference between a healthy 25-year-old and a sickly 70-year-old. You've got to look at your own
situation. Suppose you are a normally healthy 55-year-old, no health problems, but you are over 50. Should you get it now or should you wait?
When did you just go through that scenario again?
You are 4 months post your third booster.
Yeah.
You're 55 years old. You have no health conditions. Should you get it now or should you wait?
Well, you're in a group where you're eligible to have those. So then it's down to you. And what is your perception of your risk? Are you healthy? Do you have pre-existing conditions? These are, factors. It's more than just age. To some extent, it's consult your physician, factor in your own knowledge if you've got it, and do what's best for you. But you're eligible if you're 55. I mean, I'm 65. I haven't had a vaccine dose since last September. That's 10 months ago. So that's my choice based on my own knowledge of my own health. I was well vaccinated in 2021, but I haven't felt a need to go out and get a booster this year. But that's my choice. And I've got enough knowledge to make that choice. And I realize that not everybody does. There's a new vaccine that's just been approved, made by a company called Novavax, and that's been approved this week. And it's a different design, which is less reactogenic. It gives you fewer sore arms and headache symptoms. Mm-hmm. And it's not yet approved for a booster use. That'll come in the next month or so, I think. But I'll get that one when it's approved. That was the one I had in phase 3 trials in 2021. So I liked that vaccine because I was prepared to enter a clinical trial, and that will be my next booster when it's approved for use, which will be in a few months' time.
Mm-hmm. Yeah.
I mean, honestly,
the decisions.
This drives us nuts. I mean, we get these questions all the time, and there is no simple cookie-cutter answer that we can give to everyone. And then people start explaining their medical histories, and then we go, oh, well, I'm not a physician for one thing, and I'm not going to base any recommendations on someone's medical history. What I say is go and consult your physician, because that's the appropriate thing to do to interpret your medical history. Mm-hmm. But we wish that FDA and CDC or the administration in general would get with this and start to seriously give better advice, because we're having to give opinions in a vacuum of official guidance. And some of what is being said and done, and the Omicron boosters will be available. Well, yes, they will be. But what are their strengths and weaknesses? How does that affect what people should do today, which we've just discussed? It's really complicated and somewhat irritating.
Hey, what do you make of this kind of absence, Dr. Moore, of public health officials on the scene? Like I was, teasing with the first guest about Dr. Fauci being in witness protection program. There have been months where we don't see him, don't hear from him. And then I saw him recently and he went he's tying himself in knots to make sure that his message about wearing masks was not seen as some official White House mandate.
Yeah, well, I'm actually on a Zoom call with Tony tomorrow morning, so some of these questions will be.
He always said hello, and we miss him.
Yeah, I know. Well, he did have quite a nasty bout of at-home COVID, including a povloxid rebound, and that took him out of circulation for a few weeks. And he is over 80, so it's kind of not a trivial situation. Although I think he's back in good health. there is complex politics within the White House, within the COVID team, and I don't think any of us fully understand it. I don't think they have a consistent messaging. They may not even agreed on what that messaging is. Mm-hmm. It's a bit of a vacuum right now. It's hard to judge who makes the decisions, what those decisions are. It's not great. And it has been confusing for us out here who are not involved with the administration, trying to figure out what advice is going to come based on what. I mean, the Omicron booster decision, that was a done deal before the FDA had an open meeting. They had a one-day meeting. I listened to most of it. The quality of the science discussion was really pretty minimal. There was slides flashed up on screens from companies. At least one of the company guys was behaving like a used car salesman, basically buy our vaccine and not the other guys. It was a disappointing day, and I think it was pretty clear the decision was taken before the meeting, and the FDA just wanted a rubber stamp because it sounds good. We're going to adjust the vaccine to reflect what's circulating now. The discussion should have been, will that make a difference? How will that make a difference? And what messaging should we give to the public when it happens?
Right. All right. Well, final message to the public, Dr. Moore, in the absence of these, public health officials that we got used to seeing every day on TV and our social media feed, we're left, to do this personal responsibility thing, which is disheartening. Since we're not doctors, we're not public health officials, we're not vaccine experts. So what's your message to all of us who are basically going it alone in some ways?
Well, essentially we are. If you're eligible for a vaccine dose and you haven't gotten it, think very, very seriously about your decision not to get it. I mean, the recommendations are there to save your lives. If you're eligible, the number of people who have gotten the third dose, which is actually a very important one, the percentage of Americans who've got it is shockingly low. Many people have just gone, I've had 2 doses, I'm 2 and done. And if you're in a high-risk group, that's a big mistake.
So the third dose has been a low percentage of people. What about fourth? Has that lower than the third?
Yeah. If you haven't taken your third dose, you certainly haven't taken your fourth. Yeah.
What about kids? How are they doing? Kids, that seems to be a rough rollout too.
Kids should be vaccinated. But
where are we percentage-wise? 50%?
Low. I don't know the exact number, but it's shockingly low. Whatever it is, it's lower than it should be because parents have been put off by disinformation. The parents and social WhatsApp groups and whatever, and the Facebook feeds and stuff. And a lot of them have been scared by disinformation and anti-vaxxers into not wanting their kids to be the first in the class. They want to see that their classmates, how did they do? And they'll do just fine. Vaccination is important for children, but it's not happening to the same extent. Again, it's because of low vaccine uptake caused by fear of side effects, which short-term can be, noticeable. No one's pretending otherwise, but the long-term safety profile of the vaccines is outstanding. Of course, there are some serious adverse events, but that always happens with every medicine any of us ever take.
All right. Well, we've got to leave it there. Thank you so much, Dr. Moore, for your insights and helping us make sense of this almost, unintelligible
good luck to everyone.
Information coming out of our federal, health, coming from our federal health officials. I always appreciate seeing you, my friend.
You're welcome.
All right, I want to thank all my guests this morning. We're back talking about COVID because COVID is still with us. And as much as we want COVID to be over, it is not over. I'm getting so many reports of people who are getting reinfected. And there's still, as Dr. Moore said, thousands, hundreds of thousands, millions of people who are not vaccinated. It is not too late. It is not too late to get vaccinated. It's not too late to get your booster shot. We all owe it to our families, our communities, to everyone in this country to not only protect ourselves, but to protect others around us. And even though the health official in Los Angeles County is stepping up and saying wear a mask while others are not, it is very clear that if we don't do something to arrest the spread of COVID, we could very well find ourselves back. And yes, it may happen after the midterm elections. That's the reality. This is a political process at this point. Let's be real honest about it. So we could find ourselves after November being back on lockdowns, having those draconian measures that we saw in the early months of 2020. But it doesn't have to be that way. It doesn't have to be that way because we all can do our part. So make sure you're vaccinated. If you know someone who's not, continue to urge them, gently nudge them, and encourage them to get vaccinated. My words of wisdom or my words to live by, you never know whose life you are going to save. Don't take it for granted. Be safe out there. Remember, we're all in this together.